Mo is a female Caucasian teenager who is reporting symptoms of social anxiety. She has difficulty initiating social intercourse, difficulty being alone in public, and generally avoids social situations when possible. It's unclear when her symptoms began. However, she reports that shortly after entering high school, her symptoms became so severe that she dropped out and started going to a homeschool type school that only required her to be present at the school a few hours a week. Her maladaptive cognitions include believing others are watching her, believing people are judging her, believing that others wish her to fail so that they can laugh at her embarrassment, and a general belief that the world is something to be afraid of. Maladaptive behaviors include refusal to be alone in public, avoiding social situations, especially when the possibility of talking or drawing attention to herself is likely, and refusal to initiate dialogue or conversation. She waits for other people to talk first. Goals for treatment are reducing symptoms of social anxiety, increasing interpersonal skills, and establishing a supportive social network with friends and in school. The basic treatment strategy is to identify and modify specific maladaptive beliefs and behaviors, and primary strategies include utilizing support, cognitive restructuring, replacement, exposure, and skills training. Treatment interventions will include learning to control her physical anxiety symptoms through relaxation and breathing techniques, challenging negative thoughts that trigger her anxiety, such as everyone is watching and judging me, and replacing them with more balanced views. Exposure and facing social situations gradually rather than avoiding them. Group psychotherapy and psychoeducation will be useful for learning interpersonal skills and for practicing situations that would be triggering. And individual therapy should be used until Mo is ready for such a group. Potential challenges for treatment may be her tendency toward avoidance, which could cause resistance and slow development of trust in her therapist. However, once that trust is established, she may cling and come to depend on the therapist, making termination difficult. So it is critical that she feel confident in her functioning and overall sense of independence. Also, Mo will likely be resistant to group therapy, thus the need for individual sessions and establishing a rapport with the group leader prior to entering the group. Mo does bring strengths to therapy, including her intelligence and insight into her thought processes. Given her awareness of and desire to change her maladaptive cognitions and behaviors, she has a good to very good prognosis.